can come and see the baby if you give the call. He's lying with his mommy in a wee white shawl. He looks so neat and swanky like a duckling in a hanky. And we're going to call him William and his Jimison Duck McCall.
Mothers the world over want to give birth to thriving, disease-free babies. Babies the world over should, where possible, have the opportunity to start life unhindered by an infection inherited from their parents. This is the story of our Uganda project to establish a team to attend to pregnant HIV mothers so that prevention of mother-to-child transmission of HIV/AIDS is achieved at the time of birth of her child. Prevention of mother-to-child transmission is designated by the initials PMTCT. This is a pilot project being undertaken so that procedures are established which may be used on a wider scale. The funds are practically in place and the project is about to commence. By far the best hope for newborn children of HIV mothers is to be free of the disease at birth. The expense of continual treatment throughout their lives may then be avoided. Otherwise, each and every infected child will require the cost of antiretroviral treatment for their whole lifespan, needing regular antibiotics, vitamins, and the management of opportunistic infections. They must also endure the stigma attached to HIV. We are all aware that the modern scourge of the 21st century, the modern killer, the modern Black Death, the epidemic which is sweeping across parts of the world, robbing families of one or both parents and decimating working populations, is HIV/AIDS. The joint United Nations Programme on HIV/AIDS estimates that there are now 40 million people living with HIV or AIDS worldwide. Most of them do not know that they carry HIV and may be spreading the virus to others. Since the beginning of the epidemic, AIDS has killed more than 25 million people worldwide. It has replaced malaria and tuberculosis as the world's deadliest infectious diseases among adults. It is the fourth leading cause of death worldwide. 15 million children have been orphaned by the epidemic. No matter what caused this catastrophe, it is unfortunately true that HIV/AIDS is now endemic in some sections of the human family, and will remain so until perhaps in the distant future when a vaccination procedure may be discovered. This is the scene for HIV/AIDS, the sexually transmitted disease. It affects the lives of millions of people who need care and compassion. Particularly in need of care and compassion is the innocent newborn baby, who can have a healthy start in life if its mother receives the critical medicines before the birth and the baby is kept to a recognized medical procedure. Our pilot project is to do just that in one area of Uganda, aimed at those mothers who do not have easy access to full-scale hospital procedures. We have adopted the ABC logo to stand for AIDS Battling for Children, focusing upon just this one aspect of the HIV/AIDS tragedy, to see that children start life free of the disease. We would like to see Rotary the world over working to see that HIV pregnant women are given appropriate prenatal and postnatal treatment. Then no fewer than 95% of the babies of HIV mothers can be born free of the disease. Our pilot program takes place in Uganda, over a 6-month period commencing September 2008. But dare we look ahead to see similar programs throughout Africa and elsewhere? We had no difficulty in choosing Uganda for our pilot program. Uganda was the first African country to acknowledge that HIV is an epidemic, with some 40% of its children found with HIV. The initial research into prevention of transmission of HIV was done in Uganda. We also have, as a member of the Rotary Club of Middlesbrough, Dr. Kibirige, who is Ugandan but had to flee the country in the time of Idi Amin. Mohammed Kibirige is now leading National Health Service paediatrician consultant in the UK, working at the James Cook University Hospital, Middlesbrough. In addition, he has for over 20 years worked in his own time with children in Uganda. Mohammed has a great depth of knowledge of Ugandan conditions and is himself well known in that country. Middlesbrough Rotary Club and Rufec Club in France have supported other work with AIDS victims in Uganda, cooperating with the charity Child Advocacy International project, providing social and medical support to children, most of whom are orphaned as a result of AIDS. However, the new pilot project for prevention of mother-to-child transmission is a Rotary project in its entirety. We hope that our programme will provide the template for developing countries in battling for children to be newly born without HIV. The programme provides for identification during routine testing for HIV of pregnant positive women. During the birth process, infection is mainly passed on in the birth canal by exchange of fluids. Drugs such as nevirapine given at birth can prevent this. Other vital matters after birth include a safe supply of milk for babies mixed from a safe and pure water supply. Births in rural areas remote from hospitals must take place in the patient's home, since transport and the cost makes treatment elsewhere prohibitive. So the team goes to the people to give on-the-spot treatment. Rotary clubs in the UK, France and Uganda are supportive of this initiative. They are contributing to the fund, and some are giving administrative help in the initial stages. Presently associated with the project are the Rotary Club of Middlesbrough and the Rotary Club of Stokesley in District 1030, Rufec, France in District 1690, Grantham and Kettering Huxlow in District 1070, and 3 clubs in Uganda, Kampala, Kololo, Kayunga in District 9600. The business plan for the project has been costed to require a spend of $60,000 over the 6-month period. This includes start-up costs for vehicles and equipment, as well as remuneration for clinical officers, a nurse, a midwife, a driver and administrative staff. This sum will be in place by the start date. The economics of the medical effort are breathtaking when compared against the alternatives of palliative care for the whole of a child's life. PMCTC is a one-off treatment and is therefore cheap and inexpensive bargain, costing less than $10 for drugs given at birth. This must be compared with the alternative of palliative care costing $350 per year for the lifetime of the child. Although the pilot has to prove that the system of operation is fully effective, UNICEF has already recognized the principles being used and have asked Dr. Kibirige for full details so that they may copy it. UNICEF now have 2 projects underway in the districts of Soroti and Katakwi in eastern Uganda, the omens for adoption of PMTCT on a world scale are good. This beautiful country of Uganda, which Winston Churchill once described as the Pearl of Africa, deserves our help in reducing HIV/AIDS and the cost burden it imposes on the country's resources. Rotary International reputation for worldwide health projects is recognised in most countries, the prime example being the fight to eliminate polio. We look forward to proposing that Rotary International works with the World Health Organization, UNICEF, governments, NGOs and Rotary clubs to supply the drugs, counselling and medical teams needed to stop the passage of AIDS from mother to child, and thus revive communities and countries throughout the world on the pattern of Polio Plus. Fellow Rotarians, please consider what you can do here and now. Please take away one of our leaflets or a copy of this video. Can you make this one of your club's international projects? If we are to encourage Rotary worldwide to adopt prevention of mother-to-child transmission of HIV/AIDS at the time of birth as the international effort after Polio Plus, we in District 1030 must give our wholehearted support. It is up to you.